There she is, Patricia Barnett, Chief Executive Officer of New Jersey State Nurses Association. Good to see you, Pat.
Good to see you.
Pat, welcome back.
We have done so many programs on the fact that there's a shortage in primary care physicians. A lot of discussions. Hey, why don't we use nurses, particularly what kind of nurses?
Advanced practice nurses.
But my understanding is there's something called the scope of practice laws that limit the ability to use those nurses. Isn't there a disconnect here?
There is a disconnect. There's also a real misunderstanding. It was fascinating. I went to the Board of Medical Examiners meeting where they were discussing some legislation that we have to remove the barriers for APNs. And advanced practice nurses, sorry.
Right.
And they did not realize that advanced practice nurses have been writing prescriptions since 1991. They didn't know that advanced practice nurses can actually be independent practitioners. There was a real lack of appreciation of each other's roles. And I think that goes both ways. Not all advanced practice nurses or nurses understand some of the struggles that primary care physicians are having today, trying to keep their offices open with a huge burden of too many patients and underpayment in Medicaid and other places.
So, you know, New Jersey is going to experience an influx of new patients into the healthcare system because the governor has just accepted extending
hundreds of thousands.
Hundreds of thousands, anywhere from 105 to 500,000. You know, the figure varies, but it's going to be a lot of people. As Steve says, we already have a crisis of primary
lack of
primary care physicians. What will it take for advanced practice? Again, what is it?
Nurses, advanced practice nurses,
to take over that role more and more.
Well, what's interesting, the only barrier in place, because our scope of practice has been expanded over the years, the only thing that currently is an issue is the Joint Protocol Agreement.
What does that mean?
It's basically a contract between the nurse, the advanced practice nurse, and a physician, their collaborating physician. Now, this is not a mother may I or father may I agreement. The doctor does not sign off on the prescriptions. They do not sign off on the charts.
What do they do?
The requirement is they have to have this agreement that if the doctor would be available if the nurse needs to discuss something with the physician. And once a year they sign the contract, and once a year he has to review one chart.
That's the way it is here in New Jersey, because it differs in different states. Some states, nurse practitioners have a lot more.
Some states there's no restriction whatsoever. They practice completely independently.
So what's stopping that? Does the AMA or do doctors not want that to happen? Don't want to give you more freedom, to let you do it without them having to sign off, even if just once a year?
It's a mixed bag. I think the AMA has come out formally saying they're opposed to it. They're concerned.
On what grounds?
Well, they've raised a concern of quality and safety, which, when you look at the literature, the National Governors Association just came out in December saying remove the barriers, because they looked at all the literature and they said the literature shows that outcomes are as good as doctors with primary care APNs, advanced practice nurses, and patient satisfaction is greater. So the quality issue really isn't there. There's some fear by physicians that somehow will undermine their income. Other studies have shown that that's not really true. One of our sponsors, some of them, Nancy Munoz, puts it in place really well. She says there are more than enough patients to go around for everybody.
And by the way, let's clarify, Assemblywoman Munoz is in fact a nurse by profession.
She's an APN.
No, I was just going to say, before we did this, knowing that we were going to do this interview, I have some doctors in the family. I spoke to them and some other retired doctors and practicing doctors. Now, the general consensus, and of course this is not a scientific, anecdotal, was that I think all of them believed that some nurse practitioners were a lot better than some of the doctors that they knew. Their concern was the amount of training. They say that if the training is there, the ability, in their experience, is there. And it seems from some of the stuff that I read is that there's more training going to be happening. In some places, a doctorate instead of a master's is being required. Talk about that.
Rutgers University is actually moving from a master's program in advanced practice nurses to a doctoral program. Sometimes the discussion about education becomes interesting, because the physicians will say, we have a 4-year undergraduate, then we have our 4-year medical school, then we have our 2-year residency. But that 4-year undergraduate could be in political science. It doesn't have to be a science-based program.
Right.
For advanced practice nurses, they must have a baccalaureate degree in nursing, which means they have their sciences, they do hands-on care, that first 4 years. Then they go for either the master's or the doctoral level. And some of the APN programs actually require at least 1 to 2 years in critical care before you can take the advanced practice course, so that you actually have hands-on, real-life experience with patients before you go into the program.
So lots of different ways of getting at this.
There are a lot of different ways of getting at it. It's set, there's a national standard, which is set by, there's a national nursing approver group, which sets the education requirements for nurses. And the reality is, just like with physicians, they begin to expand, require additional issues as society changes, as healthcare changes. The curricula change, because we know right now we have so much more in biology and biotech world than we had 20 years ago.
A few seconds left here in the show. The 2014, January 2014 so-called Obamacare,
Yes.
the Affordable Care Act, what specifically does it say about the role of nursing, role of nurses in this whole process? Does it change it in any way?
It does.
1 minute left, go.
The Obama administration actually recognized the important role of advanced practice nurses. They put in $15 million for nurse-run clinics. They put in several hundred million to educate more advanced practice nurses, because they knew unless there were more advanced practice nurses, Obamacare would fail.
Why?
It happened in Massachusetts. When Massachusetts passed their health care reform, they found that they did not have enough primary care providers to deal with the patients. Their emergency rooms were overflowing with people who had insurance, but no primary care. There are 35 million people in this country who have little or no access to primary care.
People can talk about it, you can put it on paper in legislation and law, but you need nurses to make this happen. Pat Barnett, Chief Executive Officer of the New Jersey Nurses Association, I want to thank you for joining us. We agree that we'll be doing many programs on the role of nurses, and they play such an important role in our lives and healthcare. Thank you so much. Appreciate it. For Rafael Pilman, I'm Steve Adubato.
Good to see you again.
We'll see you next week. Thank you very much.
Great.
Thank you, Pat.
Thank you.